Okay, everyone. So today we are going to talk about urological drugs, or drugs that affect the urinary system, specifically the bladder and everything associated with it. So let's get started. So we're going to talk about two disease states today, the first of which being benign prostatic hyperplasia, or BPH. Now, a lot of these are quite common. You might see commercials for BPH, but BPH is essentially an enlargement of the prostate gland. And note the B in BPH. B stands for benign. So it is not cancerous condition. It's not a tumor or anything. All it is an enlargement that is non-cancerous of the prostate, which might obstruct urine flow from the bladder out to the urethra. So it's considered a normal condition, especially in aging men. It's considered a normal condition of aging. About 1/3 of men experience symptoms of BPH by age 60, and 1/2 of men by age 80. So this is an extraordinarily common condition. Now, there are frequent or urgent need to urinate is the most common symptom. Many people report nocturia, or increased frequency of urination at night. So they're getting up constantly in the middle of the night to go to the bathroom. And it's quite frustrating because that disrupts sleep. It might make you cranky or sleepy during the day because you just can't hold it when you're trying to fall asleep. Difficulty starting or stopping urination is also quite common in patients with BPH, as well as an inability to fully empty their bladder when they are voiding. Now, why treat it? I mean, if 1/3 of men experience symptoms and 1/2 of them by age 80, why even bother treating this? Well, without treatment, there's a greater risk for urinary tract infections, especially, as well as urinary retention, bladder stones, and even kidney damage. So it's something that is quite treatable and that we would like to get ahead with. So a lot of times, like I said, 1/3 of men and 1/2 of men by age 80 are not taking these drugs normally, but even though they might have to. So it's quite important, or it would be very, very beneficial that people are aware that yes, BPH is a condition and it is certainly treatable. And this is just a better illustration of where the prostate gland is. So the prostate in men, it's right under the bladder, and you can see the normal prostate, it's right there. And you can see the tube going down from the bladder. It's able to fully void all of that urine and waste out through the urinary tract. And now with an enlarged prostate, you can see how constricted that is and how that might be difficult to go to the bathroom or control how you are going to the bathroom. So that's where we have these issues with BPH. So what we do to treat BPH is we first use our alpha blockers. Oop, sorry. Here we go. Sorry about that. So alpha blockers, they work by relaxing the bladder muscles and the muscle fibers in the prostate to make urination easier. That's what we want to do, right? We want to urinate in an easier way. So they usually work quickly if the prostate isn't too enlarged. So early on in the disorder, they are quite good at stopping the enlargement of the prostate and restoring a normal bladder flow. And they're available in oral capsules or tablets, and very distinctive tablets that especially Flomax or Tamsulosin is the one you'll probably see the most. And that's what those capsules look like right there. They're all oral drugs. Side effects might include dizziness, especially upon standing. That's also called orthostatic hypotension. It may also cause retrograde ejaculation, which just means that semen exits to the bladder. It's quite a, I guess you could say, annoying side effect. It's not necessarily detrimental in any way because you do urinate it out anyway, but it's certainly something to be aware of. Nasal congestion is also one of those little paradoxical side effects you might not think of, and blurred vision is also reported by some patients. These alpha blockers are actually quite easy to remember, though, because they all end in the suffix osin, osin. So alfuzosin, or uraxetrol, doxazosin, or Cardura, tamsulosin, or Flomax, like I said, it's probably the most common, and terazosin or Hytrin. Those are all alpha blockers that people can sort of mix and match to determine which one is right for them. They all basically have the same side effects and same effects. Next, we have our 5-alpha inhibitors. They work by preventing hormonal changes which might cause prostate growth, and they 5-alpha reductase inhibitors. There we go. My view was obstructed and I couldn't think of it in time. There we go. Anyway, we work 5-alpha reductase inhibitors prevent hormonal changes, which might cause prostate growth. So they might take up about 6 months to work, but if they do, they are very, very effective in providing relief for BPH symptoms. So a lot of times people take them together with alpha blockers to provide quicker relief for BPH symptoms, because the alpha blockers work quickly and the 5-alpha reductase inhibitors work to decrease that inflammation, which might be occurring chronically, and keep it from being inflamed or that hypertrophy, that excessive growth of the prostate. So it keeps it from occurring. Now, we also have side effects, again, that retrograde ejaculation or erectile dysfunction. Gynecomastia, or enlargement of breast tissue, is also possible, which can sometimes be a bit challenging for men. Depression or depressive-like behavior may also occur. So that's just something to keep an eye out for. We have 2 examples here. We have Dutasteride or Avodart, that's the one pictured on the top. And then we have Finasteride or Proscar or Propecia. Now, you may have heard of Propecia because it's also used to treat male pattern baldness. So you can see before oral finasteride, before 1 milligram daily, and this is 3 months later, and you can see there is a significant change in the hair growth and sort of a mediation of that male pattern baldness that patient was experiencing. So finasteride can be quite good if the person is balding and maybe feels a little insecure about that, and they're also trying to work on treating their BPH. Finasteride might be the choice for them. Now, women who are pregnant or plan on becoming pregnant should not touch broken or crushed finasteride tablets because they are teratogenic, meaning they can cause birth defects if they are within the woman's system. So I will repeat again, women who are pregnant or plan on becoming pregnant should not touch broken or crushed finasteride tablets. So that's when you especially wear gloves, or you have another man who is working in the pharmacy to process that order for you, because you do not want to touch that. Overactive bladder, it's another condition, and this can affect both men and women, more common in women though. It causes a sudden urge to urinate that might be difficult to control, and patients might feel the need to pass urine many times day or night. So again, we have that nocturia, right? That frequent urination, especially during nighttime hours. It might also lead to incontinence as well. And it occurs when the muscles in the bladder contract involuntarily, even when the amount of urine in the bladder is low, because if the muscles in the bladder contract, it doesn't matter how much urine is in there, the urine's going to go somewhere. So it might be caused by any number of disorders, like neurological disorders. Maybe the nerves are sending bad signals into the bladder. Diabetes puts you at higher risk for it, as well as hormonal changes during menopause, excessive consumption of caffeine or alcohol, because those are diuretics in a certain extent, but any medication that is a diuretic, a water pill, like a hydrochlorothiazide or something like that, that causes you to urinate more frequently anyway. So if you are taking a diuretic on top of having an overactive bladder, that is a recipe for incontinence, and that is not a fun path to go down. So what do we do to treat overactive bladder? Well, firstly, we use lifestyle, behavioral, or medication modifications. So whether it's drinking less water, or timing out things, or even using, say, the Depends or an adult diaper to stop unwanted leaks, that might be a consideration for certain people. We have medications that relax the bladder that can be used as a pharmacological treatment. So that's Solifenesin or Enablex. Oxybutynin is the most common one, and that comes as either a pill, a skin patch, or a gel. So the pill is Ditropan XL, the skin patch is Oxydrol, and the gel is known as Gelneek, and that is applied right at the genital area. We also have Solifenesin or Vesicare and Tolterodine or Detrol. Now, the side effects of all these drugs that can be used to treat that overactive bladder, dry eyes and mouth are probably the most common, but don't drink more fluids. That's the most important thing. We want constipation. Constipation is another quite common side effect. And then also note that all extended release or topical formulations are less likely to cause those side effects. They're more likely with, say, the pill for oxybutynin than the skin patch. So those are things to keep in mind. But those are our main urologic agents that we talked about. Again, if you have any questions, feel free. Thank you very much.